Okay, wow, that's quite complex. I didn't realize medical aid was. I mean, I knew it was complex, but I guess if you don't speak to someone like yourself, it's very difficult to really cover or think about all the avenues. Yeah, good morning to Janine. Thank you for joining us. And then Sean, wow, from South Africa for so long. I forgot how important medical aid is and how blessed we are to have the NHS over here in the UK. Yes, I know, I agree. I've been in the UK for some time, and I know I'm very grateful for the NHS as well. So thank you for that. And so we're looking at what other health burdens and risks does South African workforce face? So what are the other risks that they face?
Well, if you just look at clinical risks, well, the biggest risk is not being insured. So let's park that one.
Okay.
So the other risks that you need to look at is it's your normal, what we call your infectious diseases risk, which are your typical malarias, your HIVs, your infectious diseases risk, which are almost unique to South Africa and can still be a burden certain if you work in forestry in the far northern parts of South Africa, or if you work in KZN in the northern parts. Malaria is real. It's not something that you shouldn't consider within your environment. So it depends on what type of industry you are in, what type of cover you need. So we've got the infectious diseases, it's always in the background. And then we need to remember that we all move into an aging environment. And with aging and with bad habits, unfortunately, come other diseases. And that would be your typical lung diseases. And now, lung disease, we often think, oh, this is only related to smokers. It's not only related to smokers, it could be related to your occupation. Are you inhaling dust? What kind of dust? Are you in an open groove mine with a very specific dust exposure? And some people will have a genetic susceptibility to develop these sort of lung diseases, and others would be exposed to the same and they won't develop it. So 15 to 20% of people exposed to that risk may develop a specific lung disease. So that is the occupational part. Superimpose this with your bad habit of smoking, and you may have a double whammy. Add a little bit of TB in that environment, and you have that to cope with as well. So that is the smoking part. If you now look at cardiovascular disease, that's still your major killer in the world. If you now look at all the little balls they draw us in the COVID pandemic, cardiovascular disease on a daily basis still kills about 50,000 people every day globally. And I'm not saying we're going to, so let me phrase this correctly. Death is not optional, but how do I maximize my quality of life while I'm still alive? And that is making sure that I care well for myself. And cardiovascular disease can be postponed or can be altered by caring for yourself. And how do I care for myself? It's early diagnosis, early treatment, stay on the medication. It's not something that's going to be cured, it's something that's going to need control for the rest of your life. And perhaps one should focus on the Bill Clinton phenomenon. Uh, you don't cure a high cholesterol. I control a high cholesterol. And therefore, you need to take medicine for life. It's not something until it's normal. You can now stop your medication, and that's what Bill Clinton did, and was surprised that he got a bypass graft surgery. So it's something that you need to continue for life. And those are the diseases, those non-communicable diseases. Diabetes, I think it's the other one. And yeah, we look at, you talk about office work. So if I've, and they've seen it very well in America, how it developed over the time. We've seen it in Hawaii, we've seen it in the Middle East. As soon as you move from your diet and you move from sort of manual labor environment to a sedentary lifestyle, or become a clerk, or becoming somebody that do work by, diabetes is a real concern, and that has escalated significantly. And as soon as you're diabetic, you've got all the other risk factors So we need to consider all of that in the workforce as well.
Would you say, I mean, should one do a medical health test every year to safeguard your insurance, or and how vital is it? Like, let's say, for example, some people smoke and then they decide to give up smoking. Is it important to inform your medical aid? How does that work? Because could it work against you if, say, you haven't done that?
You should actually, at least on admission, screen your patients or your employees, and then screen them on a more regular basis, especially those at risk. Uh, a lot of people don't know they're on risk. So we have these sort of health days, and it's a quick buzz and it's over. We've done research a couple of years ago where we've done at a huge petrochemical plant, looked at the workers, and we said, let your nurse that looks at occupational health, everybody must, within a month or 3 months period, go for a screening. And we did blood pressure, glucose, and a few other things. And we picked up a few patients that were unaware, but we also picked up patients that were already diagnosed by their general practitioners. But you see, high blood pressure and diabetes is often a disease given to you by your doctor. You don't go to the doctor and say, I feel so hypertensive today. It's covered because you went there for itchy toe or whatever. So now the doctor says, I've got a disease that I never had before because I didn't know about it. So now
Yeah.
you want me to take a pill that makes me feel dizzy in the morning for the rest of my life. Really? You see, and that is to reinforce the good behavior. So your health day assist in that, but it should almost be on a more continuous basis. The health day or that event or the month of screening is to find the patients that need care, to find those on chronic care that need more assistance, and then to send them, say, listen, your blood glucose is not controlled, your blood pressure is not what it should be. Please go back to your general practitioner, have a check, and come back in a month's time. I'll just check it for you. And if there's anything, I'll speak to your doctor. So that is the type of assistance that an employer needs to look at. If they've got a nurse, it's not expensive. Somebody that can be, if you've got a big setup, could be the employed. And if it's smaller, it's something that you can contract with a clinic. And there's a lot of corporate clinics out there that you can contract that will give that service. Happy that nurse, just make sure. I'm not interested in your value as an employer. Just make sure that the nurse says that you're still okay. That's all I'm interested in, because I want to keep you healthy, that you're on the correct medicine, and you take it, and therefore you're not a risk to me and your colleagues that work with you.
Sure. That's a lot to consider. Gary Human says, this is a good question. I would also like to know if medical aid would cover the expenses of hospital care due to the COVID-19 infection abroad, as this virus will be around for a long time.
So if I understand the question is whether whether a medical scheme in South Africa will cover that for someone that's not in South Africa. So your medical scheme has got very specific stipulations of what they cover outside the borders of South Africa, and there's limits to that liability as well. So yes, they will cover hospitalization, and remember, uh, COVID-19 is a prescribed minimum benefit, and it was gazetted as such, so it has to be covered. But because you're outside of the borders of South Africa, there may be in your specific medical scheme certain limits to liability for that. So there may be up to a certain rand value, but not necessarily the whole. So you must make sure of your medical scheme is what level of cover you will have if you contract COVID outside of South Africa. Inside of South Africa, they must cover it in full.
Okay, because Eve is also asking kind of a similar question on how do you cover for the pandemic, because she noticed that when she was looking for travel insurance, that all of them didn't offer the cover for COVID-19. So travel insurance, I would imagine, would be different to the medical aid scheme. So you would, correct? Would you have both, or?
You can have both, but you don't know whether that is an exclusion. So if you have an old travel insurance cover where they were unable to exclude it, it may still be included. If you now want to travel, if you're so lucky, the insurer may exclude this because it's a new threat, and the insurer insurers are risk averse. They don't want to necessarily have the risk, so they would want to insure which they know and which they actually understand, and therefore you also have an insurance premium increasing with age, because the risk with age travel increases. So that's a rand value limit that you will have, or not insurance. Whereas your medical scheme will have to cover you for the same conditions outside of the borders that you were covered inside of the borders. There may just be certain regulations or scheme rules that you must be aware of when you look at that. So they may want to transport you back. It's not possible anymore. So even the medical schemes will have to relook, how do they cover that. So it's not a simple thing. It's often better just to phone and check with your medical scheme how that will be covered.
Okay. Another question that's come in is, what is the difference between a savings plan and a medical aid scheme?
A savings plan it's often a subset of your benefits within a medical scheme. So a medical scheme may have, I'm on option X, Y, and Z, and because I'm on that particular option, I have a savings plan. So a savings plan was developed many years ago as to say that let's put a rand value within a savings value, and as soon as it's a savings value, remember that money belongs to the member of that medical scheme. It doesn't really belong to the medical scheme. However, the medical scheme may have certain rules and regulations that's approved by the councillors how you may use that money that's yours within your savings account. So that's often used to pay for day-to-day benefits, my general practitioner visit, my physiotherapy. So that would be typically your savings account. Savings account can only be used for covering what we call non-prescribed minimum benefit entities. So as soon as you go for your blood pressure checkup, which according to your general practitioner or your clinician needs to be done on a certain interval, 3 or 6 monthly, and you need to have that's a blood pressure is a prescribed minimum benefit, high blood pressure, and that should come off risk. That cannot be paid out of your savings account. So those are the things that people need to be careful and look at, as that when you've got a PMB, it doesn't come out of your savings account. Anything else, colds and flus and ingrown toenails and a cough now and then, that comes out of your savings account. Your back physio for your sports injury, that comes out of your savings account, but not your PMB stuff. That doesn't come out of a savings account. It's a subset of the money paid to your scheme that's set aside for these day-to-day benefits.
Okay, sure. So a lot to consider. So what else would you say employers could do to reduce their risks or to implement? Any final thoughts with regards to advice you can give people in general?
Well, if we're talking about an employer group, the first thing that you would do is to understand who works for me. And when I say that, it's my population demographics. Who are they? What are they? As I said in the beginning. And if I understand that, to make sure that I have a primary healthcare plan in place that will cover those type of people that work for me. So what's the problem? Is it predominantly female, and I then look for my medical scheme that gives me the best cover for those particular entities. And then you need to look at what's the secondary care that needs to be done. So if I detect a problem, so I cover female workers, so predominantly female, I'm in the sewing industry. So they would need antenatal, postnatal care. Do I get sufficient within the options of the medical scheme that I'm considering? Is it affordable enough, or should I look at something else? So clearly understand your employer group. It's important, and then a primary healthcare cannot be overemphasized.